Our first video explained about pain management and the use of oral morphine for patients. We now go on to give further advice for health practitioners about facts, myths and misconceptions of using oral morphine. This video is designed as an introduction and not as a comprehensive prescribing guide. Dr. Lydia Mpanga Sebuira, who is the Director for Education at Hospice Africa Uganda, explains further.
My recommendation is that all health workers should learn how to use this drug. Oral morphine is a strong painkiller. We need to learn that you start off with step 1 drugs, which are drugs like aspirin, paracetamol, diclofenac. But if those don't control pain, then you can go up to step 2 drugs, such as codeine, phosphate. But again, if the pain is not controlled, you go up to what we call step 3 drugs in the WHO analgesic ladder, and that is oral morphine. If we all learn how to use it, and we use it carefully and well, then our patients will be able to access it when they need it. Because so many patients come to hospice and other palliative care services, and they're in such severe pain, mainly because the health workers they have seen don't know how to use the drug and don't know how to give it safely to the patients.
What is the evidence that patients do not get addicted to oral morphine?
Whenever morphine is used for the indication of severe pain, addiction is very, very rare. One of the studies we usually quote is that of Jick and Porter, who looked at the records of patients who had been treated with morphine. They studied 11,882 patients who had been exposed to morphine, and they found only 4 cases of addiction, and that is shows how rare morphine can cause addiction when it is used for pain. Here at home, in our experience, Hospice Africa has handled 10,981 patients. Of those, 66% actually, have been exposed to morphine. We haven't recorded a single case of addiction or diversion. A study by M. Rajagopal and David Joranson was in Calicut in India, in a setting just like Hospice Africa Uganda, where they followed up patients, 1,723 patients who had been exposed to morphine for a period of about 2 years. These patients were followed up, and they didn't find any case of addiction or diversion of this drug.
Why don't patients get addicted to oral morphine?
Morphine is a Class A drug. It comes from the poppy flower, and the powder is very, very cheap. Now, this morphine, if you need a high from morphine, you need a large dose and you need to get it mainlined. That means it has to go through the vein in order to get a very high peak immediately. And it's that high peak that actually gives the person a high. But if they have pain, pain is a physiological antagonist to a high. So our patients have pain. We start with it orally with very, very small doses. When it's absorbed orally, it actually, the high dose doesn't occur. They get a small dose which is metabolized in the liver, and the active ingredients are then available to control pain.
When a patient asks for an increase in dose of oral morphine, doesn't that mean that they are addicted?
But that is not true. The pain of cancer, the pain of AIDS is so severe. They are all only asking for it because they need to control their pain. It actually means that the pain has broken through their usual dose. Now, we actually prepare the patients for this by telling them that if the pain breaks through, they can take an extra dose.
How can we be certain that oral morphine will not be diverted to illicit use by addicts?
This drug is under very strict control. It is internationally regulated, and locally in Uganda or nationally in Uganda we have a law which regulates this drug. And this drug is administered by authorized personnel, and when it is administered to a patient, the proper records are kept, and these records are sent back to the Ministry of Health and also to NDA, and eventually they end up at the International Narcotics Control Board, which is the UN agency which supervises the use of this drug in the whole world.
If we increase the dose of oromorphine, will the patient stop breathing and die?
No, the patient won't stop breathing and die. Pain is the natural antagonist to respiratory depression, which is where the drug can affect the breathing center in the brain. Now, if the patient has pain, what we do is we use very small doses of oromorphine and increase them gradually until we get to the level where the pain is controlled. In that way, we will not depress the respiratory center in the brain. If, however, you give very large doses, especially if you give them intravenously, and that go beyond the level that's required to treat pain, then the patient's breathing can slow down. Now, sometimes we actually take advantage of that. For example, in patients who are very, very breathless, like if they've got lung cancer or heart failure even, we can actually give them very small doses above the level that's required to treat pain. And that can actually just slow down the breathing enough for the patient to feel comfortable. But of course, we will not give them such a big dose that their breathing will stop. So it's quite safe if we use small incremental doses.
Should elderly patients and children be given oromorphine?
Yes, it is suitable and safe to be used with elderly patients and children. All we have to make sure is that we're using the right dose for their size. For example, for children, you have to look at the milligrams per body weight. That is because their livers are not yet mature. For elderly patients, we need to remember that their kidneys are not working as well as for young adults. And so the morphine stays around in the blood for longer. So what we do is we actually use much smaller doses to start with, and we might even need to reduce the frequency in order to maintain a level that controls pain. But it is still safe to use in children and in elderly patients.
Who are the recognized prescribers of oromorphine?
According to the international requirements, there are only 3 professionals who can prescribe narcotics, including oromorphine. Those are medical doctors, veterinary doctors, and dental surgeons. Because of the shortage of prescribers, we have got a legal instrument and which allows nurses and clinical officers with special training to prescribe oromorphine.
Are there any international guidelines on the management of pain?
We use drugs which are recommended by WHO in the management of pain, particularly cancer and HIV/AIDS pain.
What do we need in our health unit in order to be able to carry oromorphine?
There are 2 specific issues that we look at. Firstly, the issue of availability of adequate human resource, the personnel, the staff, the prescribers, okay, and the people involved in the actual dispensing. Secondly, because of the it being a Class A, it should be well kept under key and lock. So we request that we emphasize the availability of adequate storage facilities. Like, for example, a facility that has a key and lock, okay? It should be under key and lock. If it's a cupboard, it should have double key, double lock, okay? So those 2 issues are very important if you are to access the oromorphine in a facility. We need to register what is coming in and how it's going out. How has it been utilized? There are special record forms that have been developed in order to capture this kind of information to ensure that the usability of this medicine is actually being used for the actual purpose.
How do we get hold of a supply of oromorphine?
We have a form which is referred to as the return form, which is supposed to be filled in from the pharmacy record. So the data there is fed into the return form, which indicates the number of patients that have been, seen in the quarter, the medicine that they received in the last quarter, how was it used, is it HIV, is it cancer, is it any other pain-related kind of illness like sickle cell, burns, and things of that nature. So when the facility come with this return form, an order is written to instruct Mulago Hospital, which is now responsible for reconstituting this medicine, to prepare the amount of the oromorphine that this facility has requested for.
Oromorphine, the safe and effective means to alleviate chronic long and short-term pain. Brought to you by Hospice Africa Uganda with approval from the Ministry of Health and supported by the World Health Organization. This video is funded by USAID and PEPFAR.